Great. Thanks, Claire. Thanks, Shin. Yeah, go ahead and drop your name and organization in the chat if you want to introduce yourself. Feel free to share pronouns or anything else you want the group to know.
Let us know if
Yeah,
it's the first time on this call.
yeah. We'll give folks a second to pop that in the chat. And just as a reminder, if you're new to this space or it's been a while, this Veggie Rx working group is part of the Oregon Community Food Systems Network, is really bringing together people and organizations around Veggie Rx style programs. And what we mean by that is Veggie Rx or produce prescription programs are used as a medical treatment or preventative service for patients, for community members. And there's a lot of forms and models of this. And so it could be anything from a CSA share or community supported agriculture share to a Veggie Rx or a veggie box or a card or a voucher to shop at a farmer's market or a farm stand or sometimes even grocery retailers. And this space is really providing peer learning to bring folks together from nonprofits and community-based organizations, from coordinated care organizations, healthcare, the Oregon Health Authority, and other folks that are interested in this type of model. Yeah, so that's just as a heads up. Thanks for putting your introductions in the chat too. I will do mine verbally because I'm bad at talking. Care organizations. Care Oregon is a social health specialist supporting providers in the metro area who are helping provide health-related benefits and have started and ran a Veggie Rx program in the past. And so that's why I'm involved in this work. Yeah. And today, like I said, we've got, we're doing some introductions. We've got some wonderful speakers, including, and is it Kaila? Is that how you pronounce your name? Kaila from UC Veg. Okay, thanks. Whoa, something really cool just happened where you popped on the screen, Shin.
I was trying the different layouts. I was
It's
hoping that it
very
would be
cool.
clear who would be in the bottom, but it was me.
I love it. It was a very cool feature. If yeah. Um, so sorry, Kaila from UC Veg is going to talk about their model in Roseburg. So we're lucky to have her. And they use the Fresh Connect or AboutFresh program. And so we also have Machayla. Am I saying your name right?
Yep, you got it.
Awesome. Thanks. From AboutFresh, which has this platform to support Veggie RX type programs. And she's going to go more into depth on all of that. So we're excited to have them both. And then we also have Gina from OHSU to talk a little bit more about Toward Health Lifestyles Initiative, which will go more in depth, but it's a potential funding opportunity here in the metro area. Shin or Claire, did you have anything else you want to like announcements? Oh, well, we started talking about this a little bit, but that November in-person retreat for OCFSN, not just this working group, but there will be representation from other organizations who are working in the food and farm realm of things. Shin, do you want to?
Yeah, we're expecting about
Yeah.
150 people to come from all over the state. This will be the first time that we are gathering in person at this volume since 2019. That was our last full network convening. Since 2022, we've had a number of smaller regional convenings. But yeah, we're expecting folks coming all the way up from Southern Oregon and all the way from Northeast Oregon. And we're gonna have 3 days together. So really excited. And if you haven't registered yet, definitely please do that by ideally tomorrow, but Thursday is probably okay. And yeah, definitely look forward to seeing a good amount of you.
Awesome. So thanks, Shin. And Claire popped in the chat there a link to that convening, so y'all can check that out. I am gonna pass it over to Kaila, and my neighbor just called me because she's locked out of her house, so I'm gonna pop off screen and miss the first part of your introduction, Kaila, to get her into her house, and then I'll pop back on.
Can I
Take it
share my
away.
slides?
Oh, yes, please. Are you able to do that? Are you able to?
I don't have access unless somebody just gave it to me.
I'm
now I do.
working
Okay, cool.
on it.
Let's see.
You know, I don't see a pop-up. I'm working in the web version, the browser version of Zoom. Shin, do you have the power to
Yeah, Kaila, you're a
do
co-host
a
now.
session?
You should be able to
Thank
share.
you. All right. Can you guys see that okay?
Looks great.
Okay, awesome. So, hi, I'm Kaila Luttrell, as you all mentioned. My organization's gone through a bit of a rebrand. I'm actually Food is Medicine Oregon now. UC Veg is still the parent organization. And we've been doing evidence-based lifestyle and nutrition education in Douglas County that's geared towards chronic disease prevention and reversal for over 10 years now. So the food as medicine aspect better defines what we do. So, and I'm here in partnership with Thrive Umpqua. Thrive Umpqua is our community's well-being initiative, and it's a continuation of Blue Zone's Project Umpqua, if anybody remembers that. And they're really the organization responsible for starting the Veggie Rx program in partnership with lots of folks in the community and also funders as well. So I want to make sure they get credit for the program too. And the overarching vision for the Veggie Rx program is to, at a broad level, integrate fruit and vegetable prescription programs into, oops, what did I do there? Into our local medical system, because as I think Kaylee referenced earlier, it's such a powerful tool for combating diet-related chronic disease and also food insecurity. And four of the kind of main objectives of our program is to mitigate barriers to health, also to inspire individual behavior change, also strengthening food security and reducing diet-related chronic illness through nutrition, which is a really big problem in our community. I had to use these photos from, I don't know if anybody recognizes this, is the Oregon Community Food System Network Veggie Rx Conference in 2018 in Silverton. I was not there, but you can see the former program manager there, Juliette Planches. Veggie Rx launched in 2018 as a pilot project with one clinic partner, one redemption location, and seed funding from Mercy Foundation to run an 8-week pilot. And it was designed and operated by Thrive Umpqua, which was then known as Blue Zones Project Umpqua. And it had critical support from multiple community partners, including members of our local food system committee, OSU Extension, and UC Veg, which is the parent organization of Food as Medicine Oregon. And since the program launched in 2018, Veggie Rx has really been connecting our local medical system with the food sector by creating relationships between our clinic staff, their patients, our local farms, and also our markets, food retailers. And the way the program works, in case anybody's unfamiliar, healthcare providers write prescriptions for their patients to eat more fresh fruits and vegetables. And then their patients can fill these prescriptions at our local farmers markets, farm stands, and also through national retailers through the use of a debit card that's issued by Fresh Connect or AboutFresh. And each participant gets $80 a month to spend on fresh fruits and vegetables through the program. They also complete pre and post surveys and biometrics with their providers at the beginning of the program and the end of the program, so we can measure the impact that the program is actually having on individuals in our community. And then throughout the program, the participants receive free nutrition and garden-based programs and gas cards as additional incentives to come back for that post-assessment appointment. So Veggie Rx program's in its 8th year now, and over the last 8 years, the program has not just sustained, but it's also expanded and it's evolved into a model that's sustainable, and it operates for 6 months at a time with multiple clinic partners and multiple retail redemption locations now. And of course, this is only possible with strong community partnerships and now lead funding from Umpqua Health, our local CCO. The program runs May through October. Enrollment starts in mid-March, so that's when the patients come in for their pre-assessment appointments with their providers, and it goes live in May. So this is just a sample program outline that we distribute to the clinics so they have a sense of what happens in the program throughout the year, so not just those 6 months. And then, as I mentioned, over the years, the program's evolved and grown. So in the top left, you can see we used to use paper vouchers. So we've transitioned from paper vouchers to debit cards, and they can be used exclusively on fresh fruits and vegetables. And this has really allowed us to expand the number of redemption locations that are available to program participants. So we started with one location, which was a farmer's market. And this year, we are currently at 9 locations now in our local community. And then we've also been able to increase the amount that all program participants get to $80 a month. So it used to be about $40 a month for individuals, but now everybody gets $80 a month. And then we've also expanded from 1 clinic partner up to 5, and we're accepting referrals for the program through UniteUs, and have been continuing to translate our program materials into Spanish. And then again, Umpqua Health continues to support the program. Our clinic partners collect referrals year-round. So all year, they are looking for patients who fit the program eligibility for chronic illness or food insecurity or both. And they schedule enrollments for mid-March through April when patients come in for their pre-assessment appointments. All the patients, all the referrals go through UniteUs, as I mentioned, and then the clinics enter everybody into Fresh Connect to trigger a debit card to arrive in the mail. And then at their pre-assessment appointment, they do a survey, they do biometric assessments, and then they also get a packet of information to take home with a schedule for the program, information about how the card works, nutrition resources, information about non-emergent medical transport, and then events that they can participate in, different programs for nutrition and garden education. And then the clinic partners attend a monthly clinic check-in meeting where they can come, they can ask questions, they can share feedback, they can share best practices with each other. And then they can also pass back information from participants or share, any questions or difficulties or something they hear about from the participants. So we can kind of keep a continual feedback loop going. So it's not just disconnected once enrollment's over. And then our clinics also have a call script, so they can log into the Fresh Connect platform and see if their patients are using their cards or not. And if they see low engagement, they can give them a call and just ask them how the program is going, let them know about other resources available to them, and really encourage them to spend the funds on their card. And then at the end of the program in October, they come back for their post-assessment appointments, and we do encourage them and incentivize them to come back with a gas card. And those run the same way, surveys and biometrics, and collecting feedback as well. And then, as I mentioned, all the referrals go through UniteUs. So I think Shen mentioned there was some interest in hearing more about UniteUs. I think they don't like their platform to be like recorded. And so I didn't include any screenshots from it, but each clinic has their own distinct Veggie Rx on Club profile, and it's separate from any existing profile that they might have in there. So they can receive referrals year round from anybody in the community who's also using UniteUs for their Veggie Rx program. And then if anybody is using that right now, I don't know, it can be handled as either an internal case or a referral. We have different workflows depending on if a clinic is using an EMR to use the UniteUs or if they're logging in through the web portal. And then everybody gets closed out before the end of the program. And then I'll keep this brief since Machayla's here to share about AboutFresh or the Fresh Connect platform. But on our end, it's a very simple enrollment process for the clinics. And I mean, they just fill out a form and then the participant gets a card in the mail. It's very easy for us. And then the cards are reloaded every month with a fresh $80. So on the first day of the month, it's all automated. And as I mentioned, clinics can log into the platform and check on patient card utilization and give them a call if they need to. And then we also have other touch points, so text messaging and Fresh Connect does their own calls to kind of help encourage people to use their cards and keep the redemption rate high. And they're automatically disenrolled on the last day of the platform. Or sorry, last day of the program. And as I mentioned, we have 9 redemption locations this year. A good handful of them are local farmers markets and farm stands, and then there are national retailers as well, like Fred Meyer, Safeway, Walmart, and Costco. And all the retailers at the beginning of the program, they get a sign that says Fresh Connect accepted here for fresh fruits and vegetables. They get frequently asked question cards that go next to their registers, so they don't have to be an expert on how the program works. They can just reference that if they get a question from participants. And being able to expand like this is really important in our area. One is because we're rural, and so patients might live 30 or 40 or even 90 minutes from their provider. And so they might be able to come in for their medical appointments because that's a really high priority, but it's not really convenient to travel that far to buy food. So being able to partner with the Canyonville Farmers Market and say like, oh, hey, if you're in the south part of the county, which is very, it might be a 30 or 40-minute drive to their medical provider, they might only be a 10-minute drive to the farmers market. And then it's also important because we get to partner with our local growers and farmers markets and help support our local food system. And the program obviously works best when people are using it. And so redemption rates are really important. We really want people to experience the benefits of eating fresh fruits and vegetables. So if they're using their cards, they're presumably getting fresh fruits and vegetables into their home. And then once it's home, it's super easy to eat. So some of the things that contribute to higher redemption rates we found are getting participants their information packets at their pre-assessment appointments so that they know how to use their cards, they know what to look out for in the mail, they know what educational programs are available to them to help them figure out how to use the produce that they're getting all of a sudden. Also expanded redemption locations. If it's easy to get to somewhere where you can use your card, then you're more likely to use it. Text messages, like I mentioned, through the Fresh Connect AboutFresh platform. And then I mentioned the Fresh Connect team will call to if they see somebody hasn't activated their card or hasn't been using it. And then our clinics do check-in calls with the call script. And then nutrition and garden education programs. And we also reach out by email. So lots of ways to encourage participants to use their cards and subsequently eat more fresh fruits and vegetables. We have found some best practices for participant engagement or identifying participants who are more likely to engage with the program. And if there are too many barriers, participants will be disengaged. They will not be using their cards. So gas prices could be a barrier for some folks, especially if they're food insecure, and especially living in a rural area where it might take some investment in gas to get to a grocery store or a market. Public transportation or not having access to it, or having health problems that prevent them from getting out of the house. So we found successful participants typically have a kitchen, they have reliable transportation, they're able to use a debit card or a credit card and to make phone calls to check their balance. And they're able to show up to scheduled in-person appointments for their enrollment and their post-assessments. I mentioned we also offer nutrition and garden education programs. So in May, when the program kicks off, we have a table for the whole month at all of our farmers market locations and some of our farm stands. And there we have healthy recipe samples. We give farmers market tours. We have resources, so recipes, produce guides, ideas for how to use what you're finding at the market, non-emergent medical transport, a lot of what's in the participant packet, but other inspiration as well. And then this year we partnered with a chef to offer a shop with a chef for the Veggie Rx participants. So who knows the market well and loves the market and loves to share it. So he did a tour just for our Veggie Rx folks. And then we also offer gardening and cooking classes that are tailored towards the Veggie Rx audience. So folks who might not be able to add kind of more boutique ingredients to their dishes. So we try to keep it simple and really focused on the produce that's here in the area, and also how to continue, because it's a 6-month program, how to continue getting access to that, to fresh fruits and vegetables by growing them potentially year round or after the program comes to an end. So what impact does this have on our community? The program's still running for 2025, so it's too soon to have some numbers for 2025. But in 2024, we had 202 patients enrolled across 5 clinics. 94% of the patients actively participated in the program. On average, they used their card 16 times over the 6 months. And then almost $70,000 was spent on fruits and vegetables in our community by these 202 participants. So improving their access to healthy foods. And then we don't just look at the individuals enrolled in the program, we also look at who else in the household might be impacted by this, because most people don't just grocery shop and bring it home and eat it all themselves. So we had 469 household members impacted by the program. 60% of the participants at the end of the program reported reduced food insecurity. 83% of people who participated in 2024 said they tried new fruits and vegetables. And then we saw improvements from the beginning in meeting recommended servings of fruits and vegetables, and improvements in rating their health good or excellent. And then very interestingly, this is not a weight loss program. We don't talk about weight loss. We just give people access to fresh fruits and vegetables. 60% of the participants last year lost weight during the Veggie Rx program. And on average, they lost 12.7 pounds per person, with a total of 926 pounds lost total across everybody in the program. So it's a very noteworthy outcome. Our participants, as you can see, are typically white or Caucasian, mostly female, and mostly on OHP or Medicare. 68% had SNAP benefits, and 5% had WIC benefits. And then 58% reported a household income lower than $35,000 a year. On average, each participant spent $355 on fresh fruits and vegetables during the program. Just under $5,000 of that went to local farmers markets and farm stands. Our vendors appreciate the program as well. Drives more people to their markets or their stands or their stalls at the farmers market, their booths. And the Umpqua Valley Farmers Market said they love the program, such an amazing opportunity for people to be prescribed healthy fruits and vegetables by their doctor. And then several participants provided great feedback last year. One of them was, it's gotten me out of the house. I feel more a part of the community with being able to buy food at the farmers market. It's given me more freedom to eat a larger variety of fruits and vegetables. Another person said, my fridge is always full with healthy options for my children. Another reported their A1C went down for diabetes, and the program helped them with weight loss. And another reported it helped keep their blood pressure lower and they had lower inflammation, less fatigue, and better overall health. And then since looking at a year-over-year comparison since 2021, the number of household members has increased, number of participants has increased, and the number of program completions has gone up significantly as well. And then the redemption rate hit a record 72% last year, which was super impressive for, it just speaks to the ability to encourage people to use their cards and also provide more and more locations for them to use them as well. So that's where we ended last year. Data is still coming in for this year. And big thank you and shout out to all of our partners and funders. It takes, I mean, this slide is getting so big, we're so busy, we're gonna have to shrink the logos pretty soon. It takes a lot of clinic partners, a lot of market vendors and markets themselves, and even the national retailers, and of course our funder, Umpqua Health. So I will end there. Does anybody have any questions?
Thank you so much, Kaila, for all of that great overview. Folks are welcome to just come off mute if you do have questions for Kaila, or put them in the chat. We can look at those.
I have a question. I'm curious about, you mentioned that they receive $80, each participant receive $80, and it's for participant or per member in the family?
Oh, it's per enrolled individual. Yeah.
Yeah.
I was curious about the breakdown of where the money ends up being spent. I think one of your slides touched on this, but if maybe you can review it real quick, how much is going to like the local markets versus the national retailers, if you've calculated that.
For this year, I'm not sure. It kind of fluctuates. One year it was 10,000, last year it was 5-ish. We do see people really shopping a lot at Walmart. I mean, yeah, a lot of folks are struggling, and we really encourage them. Like, we don't push the national retailers, honestly. We do really focus on the farmers markets and the local farm stands, but people will shop where they want to shop. Yeah.
Sure. Yeah, I'm not trying to judge that choice. I'm just curious about the breakdown. So it's 10 to the local markets, and then what's on the flip side, the national retailers? Was your total around 70,000 that was being spent?
Yeah, last year it was like 69,000 total, and last year was only like 5 to the local markets.
Interesting. Yeah. Okay, thanks.
Yeah.
And it looks like there's a question in the chat from Megan. Could you share what the biometrics that you collected are?
I have to look at it. I think I know like weight, height, BMI are, I don't remember all of them off the top of my head, honestly. It's a pretty extensive survey, but I'm happy to share that later if that's helpful.
I also have a question about,
sorry.
Go ahead.
I was curious. I had a follow-up to that biometrics question. I'm assuming it's done pre and post.
Yes.
And I wondered who is doing that, as well as who is actually doing those. You said there were some kind of follow-up calls, like monthly follow-ups, to make sure people remained engaged. And I was wondering who was making those follow-up calls.
Yeah, so they go to their clinics for the assessments. So some clinic staff. So it might be a nurse practitioner. It's probably not the doctor, but it'll depend on the clinic doing the actual like the assessment itself. And then the follow-up calls, the clinics assign a lead for the program and a backup lead, and they divvy up who makes the calls. And so at one clinic, it might be like a physician's assistant. At another clinic, it might be a case manager. It just depends on the structure of the clinic.
Could you talk a little bit more about the enrollment criteria? So it said either chronic illness or food insecurity, which seems really broad in a good way, but do you just enroll as many people fit either of those and then cap it at a certain amount? Or how do you decide who is enrolled or not?
Yeah, so it's up to the clinics. So they have to be either food insecure or experiencing chronic illness or both. Some clinics might say like, oh, you have to experience both. Some clinics might say, oh, we'll take either one. It's up to them. And then really the cap is placed just by the amount of funding that we get. So each clinic, they give us an estimate of how many patients they think they can support, like they have the capacity to support, because it does take some time to bring everybody in for the appointments and do the assessments and do the follow-up calls and come to the check-in meetings. And so bigger organizations tend to have more capacity. They have more people. Smaller clinics tend to have less.
You had mentioned that this program is funded by your local CCO, Umpqua Health. Is that just the fruits and veggies? And if so, is that funded? How are they funding? Are they funding it through Flex? Are they funding it through something else? And is that funding every aspect of the program, or is there other funding coming in?
Yeah. So this program is exclusively for fresh fruits and vegetables. Beyond that, I actually don't work on the funding piece. So Jess Hand, who's the executive director at Thrive Umpqua, would be the better person to answer that question. Yeah. Sorry, I don't have more information for you.
Claire, I think, did you still have a question?
No, I didn't. I was going to ask if the biometric kind of survey was self-reported or if it was, done in clinic, but that was answered in another answer. So no, thanks, Kaylee.
Okay.
And it does look like Shin added a question in the chat about the barriers to year-round local food through Veggie Rx. So Shin was saying, I know the barrier to year-round local food through Veggie Rx can be seasonality of farming, but since you have national partners, what is the barrier to offering a year-round program?
It's likely funding and probably clinic capacity, because it does take work. Those would be the two key. I took over for Juliet this year, so I don't have the full 8-year historical context, but those are the two that I see that are most obvious.
Kayla, I have a question for you, and apologies, you might have spoke to this already, but curious about how like the clinics got engaged with the program. Like, was that something that they were really wanting to do and then reached out and said, hey, like, can we be part of this? Or were they kind of recruited? Yeah, if you could speak to that. Thank you.
Yeah, it goes both ways. So sometimes the clinics hear about it. Sometimes they see it in UniteUs and they call us and they go, I just learned about this because I saw you in UniteUs. And sometimes, we proactively reach out based on, we work in the community and public health, and we meet a lot of clinics and people who are trying to do good things for public health in the community. So, you know, we might proactively reach out, or they may reach out to us. Goes both ways.
Thank you. And just a quick follow-up to that, if I may. Thinking about like scalability of that, like, is that something that, you know, like you work primarily with like the local clinics directly in your area, or, you know, like just thinking like I'm in Portland and, you know, we would love to do this in Portland, but we're like, yeah, like how do we get involved basically? And like, you know, yeah, would it kind of be us like trying to find something locally that does something like this in Portland, or would it be, yeah, like would we be able to connect with you? Like how broad do you go in terms of statewide spread?
Yeah, well, our funding is specific to our local area. However, I know we've shared in the past our model with other groups that want to get something started, and I'm sure that would be, you know, totally fine to share our processes and resources and expertise, yeah, experience.
Thanks, Kayla. And Lauren, I'll just make a shout out. There's a lot of people on this call too, or a few people on this call who are in the Portland metro area. I'm looking at Sylvia on my screen. I'm looking at Anna. Lucia is in Washington County area. Megan is in Portland. You can call out yourselves too in other places, but we're happy to like kind of match make if you want to connect with some folks in the Portland metro area to talk about other programs that are around. That's really to what this group is about, to like make those connections and see what other resources and programs are in your local area too, as well as like hearing different models around the state that are doing great work. So yeah. I see Anna's question in the chat, and we're gonna like shift over to Machayla's presentation. So maybe that will also get answered there. But Kaila, thank you so much for sharing, and welcome to this world. I know this is your first year and taking over for Juliet, and it sounds like the program is continuing to thrive, no pun intended there, or intended fully. Yeah, thank you so much. Really appreciate it. Yeah. So I am going to pass it over to Machayla. And Machayla, do you have slides that you want to share?
No.
Okay, great.
That's
little
great. Casual here.
Yeah, love it.
Thanks. Thank you. So again, my name is Machayla Fortin. I'm the Cardholder Experience Director for Fresh Connect. And I work for AboutFresh, which is the nonprofit that the Fresh Connect program is run through. So I work with Kaila. Adelante is on this call too. And so it's really nice to hear from you all, Kaila, and like see how our program's being implemented on the ground, because we have a lot of different partnerships that are in different areas across the country, and we work with organizations such as yourself. We work with a lot of community-based organizations, and we also work with a lot of Medicaid contracts, like through in Massachusetts mainly, and into New York, and we might even be expanding into Oregon next year. It's a really exciting time. So Kaila already did a great job of talking about the Fresh Connect card and the program. So I'll try to highlight some things and then really just open up for questions. I will say there are going to be questions that I can't answer. Like if you have specific like contracting questions, that is not for me, but I will answer what I can, and happy to bring back questions to the team that anybody has that I can't answer. So as the Cardholder Experience Director, I run our cardholder success team, which is a very small team, and we really focus on outreach to our cardholders, making sure that folks are truly supported in their program. And then I work really closely with a lot of customers like Kaila, like Lucia, at Adelante. And if you ever work with us and email a support inbox, that will be me. I will be the one that's like triaging any questions that come in about the cardholder experience or just the platform itself. So I'm going to pull up my own little notes here, but to back up, as you know, Fresh Connect's a produce prescription program, and we have three main components of our program. We have our card, our team, and our platform. And so our card is a prepaid debit card. It's bright green. It looks like this. We've gone from Visa to MasterCard a few times, but we love that we have a bright green card. So I always try to show it off whenever I'm on a call. And it really just empowers cardholders who are enrolled in our program to have a very easy time with using the card. It swipes just like a debit card. And it just, I'm sorry, I'm stumbling over my words here, but we're very passionate about it being a very dignified experience at the grocery store or at the farmer's market. So we work closely with folks who run their own farmers markets and they want to be able to accept Fresh Connect. We'll call them up, we'll do test transactions, making sure everything goes smoothly if they want to be added to our retail network. And then we're also part of what we call our filtered spend network, which is going to be the thousands of grocery stores across the country that folks can go in, ring up all their groceries together, swipe their Fresh Connect card first, which will pay for their fresh produce, and then use a different form of payment to pay for the rest of their groceries. So it's very seamless. And again, just we are really proud of that dignified experience for folks using the card every day in public. So that's our first main component, our card. And our second main component is our team. As I said, I run a cardholder success team whose full-time job is supporting cardholders. Our platform will give us prompts when to reach out to folks depending on when they were enrolled and what kind of support they need throughout their time on the program. And then we also take inbound calls, inbound text messages from anyone at any time as well, in addition to having the 866 number on the back of the card, which is a separate call center that folks can call with like more general questions, help with looking at their balance, things like that. When we're closed on Saturdays and Sundays, they still have like an extra call, an additional call center that'll support them with the card as well. And then the third main component of our program, as you've heard, is our platform. So our Fresh Connect platform is HIPAA compliant. It's all web-based. So all you really need is a browser and you can pull up your platform. And that platform really supports end-to-end program management. So everything from enrolling cardholders into the program, documenting outreach and interactions throughout their time, looking at transactions when they've used their card, where they've used their card, and then data and analytics too. So we have like a great reporting feature and a dashboard feature as well for our customers to log in and utilize at any time. So I think I came on to the team April of 2022. So I've gotten the pleasure of working with Adelante and Thrive for over 3 years now. So for Kaila, your team, it's been 3 years of just seeing how the program has changed a little bit and adapted every year. And it's really wonderful to work on. We do text messages to her participants as well, really encouraging them like, hey, this workshop is coming, or remember to use your card at this local farmers market that's going to be around on Saturday at this time, etc. So we love being able to really support additional outreach and those extra like components that not every program has. Like we love working with small programs like this. And I think I saw a question about the number of participants, right? So Anna, you were asking the minimum number of patients to launch a Fresh Connect program. Typically we have a director of customer experience and she'll go through like the contracting process. So if we have additional questions, I can go back to Casey and ask, but we usually have a minimum of 150 participants. And that's just because a lot of time and effort goes into contracting and invoicing and then supporting cardholders through the program. So something smaller than 150 would just be really administratively burdensome. And then the administrative cost, it can vary. We do have admin fees that can come with programs depending on what type of program it is and what size. But typically there's a fee per cardholder, so per someone who's enrolled. And then something that we're really proud of, as I've said a couple of times, is my team doing our outreach support. And we can do it in a few different ways. Some programs want to pay us to do it. They want to enroll their cardholders into the program and then know that my team is going to be supporting them throughout their time. Other customers say, nope, we want to do that ourselves. So please teach us how to navigate the platform, how to use what we call our check-in features. That's how we are prompted to reach out to folks or document interactions with cardholders too. And they want to do that themselves. So we'll provide training for the platform and our outreach model, how to navigate the platform. And then they don't pay that like additional cardholder support fee if they want to do it themselves. But still, my team is available for any inbound inquiries too. So anyone who calls or texts us can always be assisted. So in the last couple of years, I wanted to just highlight a few big things that I think has been really exciting over the last 3.5 years to see, and then open it up for additional questions. As I've mentioned, our platform supports our outreach model, which comes in check-ins. And the two main examples of that is what we call our welcome outreach. So after someone's been enrolled into our program, we reach out about 2 weeks later. We want to make sure they've gotten the card in the mail. We want to make sure they know how to use the card, where to use the card, any other program details that we might be able to assist with, so that folks feel really confident in going out and using the card. They know how to activate it, where to use it, how to use it, and it gets them started on a really good note with the program. And we'll reach out a couple of times if folks, maybe don't get the card and we have to order them a replacement card. We'll follow up on any replacement cards that we order too. And then the other big outreach type is going to be our inactivity outreach. And Kaila mentioned this too. If someone is not using their card, sometimes there's a few different reasons, but a lot of the times they just need to be reminded. Just a simple text message or phone call saying, hey, remember that you have your Fresh Connect funds. They don't roll over month to month. So we really want to encourage you to make sure you're using your whole allotment. And I've seen disbursement amounts anywhere from $40 or $50 up to $200 or more dollars. So it really depends on the program. And sometimes people just need another nudge or a reminder to use it. Or other times they've just been going through life and just need support of like, okay, remind me what this program is, remind us, where can I use the card? Those types of questions my team is really equipped to help with. We also run into sometimes they've lost the card and they simply just didn't know how to call to get a replacement card because they've lost it. So my team actively reaches out and we'll help folks with that too. And we have a great feature in our platform that allows team members to work together, where we have a big list of check-ins that are due. And so folks either on my team or the partners team can go in and select what check-ins they want to work that day. Maybe they want to focus on people who speak Spanish and there's welcome outreach due. And so I have a team member, Brenda, who will go in and select those, and it will be part of her list to work on that day. Whereas my other team member, Nora, who speaks only English, will focus maybe on the English folks who have welcome outreach and inactivity due that day. And you can claim things, and that way there's no not knowing who's doing what. It's really obvious within the platform, and it allows us to work really well together, especially with customer users who could also be logging into the platform to be looking at cardholder profiles or with questions of their own too. Also within our platform, we have a great report called the engagement report, which will download all demographics for your cardholders, as well as information about what's the most recent check-in type that just happened, what happened during that phone call, when was their last transaction, how much of their money are they spending per month, etc. And it's been a really exciting thing to see that report evolve over the years because it did not look like that 3 years ago. And I know I was supposed to talk for 10 or 15 minutes. So I would say one other big thing that I'll mention right now, and then would love to just open it up, is right now we have our one card type, which is for fresh produce. But in 2026, we're actually launching 3 new cards that are going to allow different types of programs. So not just a produce card. One will continue to be our produce card, of course. But then in addition to that, we're going to have what we're calling a Produce Plus card, which would allow folks to buy fresh, frozen, and canned produce. And then we're gonna have 2 different versions of a grocery card as well, which will expand to like the full grocery store, but have different limitations that has really taken months of work to look at different nutrition contents with scientists and with different experts in the food and medicine field. So that's been really wonderful to work on and is coming in 2026. So again, if anyone was ever interested in a program like this, but wanted to be able to offer more than just the fresh produce, maybe you really were like, my population needs to have access to frozen or canned or both, we're going to have options for that in the new year. And I'm happy to help introduce you to our customer experience director, Casey, who can talk to you about the different program types. I will be quiet and check the chat, but please feel free to just come off mute and ask any questions as well. So Gina said, can one card holder carry multiple types of cards with different benefits just be allotted to one card? That's a great question. We've never had multiple types of cards before, so I don't know if I can actually answer that for you. I don't think I've heard of someone wanting to enroll a card holder and I want you to have a produce card and I want you to have a grocery card. It could be possible, and I don't see why we couldn't be able to do that. So the 2 other types of grocery cards is one is going to be a broad grocery card, but one of them is going to be more of a medically tailored. So I pulled up my description of that. So our medically tailored grocery card will have specific nutritionally dense foods across the grocery store. And that'll be really focused on adding proteins, whole grains, and dairy. I think it'll have fish and chicken options as well as like the frozen and canned produce options. And then the wider grocery card is just going to expand that a little bit more protein options, more of the grain options that aren't just like the whole grains, and just expand it a little bit more. It'll include water on the grocery store, on the broader grocery store card as well. But we're really excited. We're still in the midst of figuring all of that out, but we're looking forward to it. It's October, so that's happening in a couple of months. Wow.
Thanks, Machayla. Yeah, and feel free to keep some more questions coming. I did want to note this meeting is scheduled until 10:30. Sometimes people have other things going on, and so you have to hop off at 10. That is totally fine. But just wanted to give a time check for folks too. Yeah, other questions for Machayla?
I hope that means I did a great job and no one has questions, so I will take it, but feel free to share my email address, and if someone does have follow-up questions that you have later this afternoon or next week or anytime, feel free to reach out.
Actually, so I work at a place that is kind of a food hub, kind of a food pantry. Excuse me, I haven't spoken yet today. And we just bought a building. We're trying to make this like food justice center, and ideally we're going to be able to bring in a clinician at some point to work with our clients that come through. Does that seem like something that might work to get our customers involved in this program if we have like a clinician there, or does it have to be their primary care physician?
Nope, no, absolutely not. we'll contract with community-based organizations or healthcare organizations, and the criteria for a partner's program is completely up to the partner. So
Cool.
sometimes it is Medicaid, like if it's through a Medicaid contract, of course, you have to have certain type of Medicaid, chronic nutrition risk, etc. But some of our CBOs will just say that someone comes into their programming and is food insecure, and they want to provide this as a benefit.
Okay, yeah. I want to do that.
Great.
I had a question, Machayla. You mentioned that you might be expanding into Oregon through the Medicaid contracts in the coming year. Could you speak a little bit more to that and how we can find out, like, just keep in contact and find out more?
Yeah, so this is where I'm going to wish that I had asked Casey for more information potentially, but I know that we are working with the Umpqua Health's SCN, and so that's as far as I know right now, that will potentially be contracted through that SCN program and be an option for folks to enroll their the members into Fresh Connect. That hopefully almost answers your question.
Thank you. Yeah, if there's anything additional, any other contracts, how would we find out about that? Or how could we push for that, I guess, alternatively?
Yeah, right. I mean, I think, Kaila, you might know a little bit more about this than I do, but I think that's the only thing I know of in Oregon right now. We're working through SCN contracting in New York State as well. I will say those things take a really long time. We're pretty experienced in Massachusetts with the 1115 waivers. We launched a lot of our programs in Massachusetts because we were Boston based, and now we're not. But if you want more if you want to talk more about like how we can partner or get us into different hub models, I would definitely introduce you to either Adam, my CPO, or Casey, our customer experience director, who can really like go through the contracting process with folks and be more attentive to that.
Thank you.
Yeah, of course.
And Sylvia, I can jump in here too, having some insider knowledge as well. But I think there is some interest in maybe having Fresh Connect or AboutFresh as a HRSN vendor for some of the upcoming fruit and veg and pantry stocking benefit portions of the HRSN benefit. So.
Hi, I'm Lucia from Adelante, and although I don't have a question, but most a comment. I work with a Fresh Connect card. We have a program of 80 households, 336 individuals in the program, and they use the Fresh Connect card. And what we do is our participants sign an agreement that they are going to use the Fresh Connect card in the farmers market during farmers market season. And when they are in November, they can start using the Fresh Connect card in the approved markets, Walmart, Fred Meyer, and they signed that agreement, and they mostly respect it. And we are in charge of doing the check-ins with the participants. AboutFresh helps a lot when we run into some problems. Machayla, I've known her. I know for a long time through email, but I think this is the second time that we see each other. But it's been a great experience for Adelante to work with the Fresh Connect with AboutFresh. Mm-hmm.
Thank you, and same here. We love your program as well.
And Lucia, thanks for mentioning that too, because I think that gets back to maybe Jared's question around like how those dollars are spent for participants, whether at the local markets and with local farmers versus retail partners, and how each program can kind of create their own system or how they promote the use of the card with different retailers or local farmers too. And what you mentioned too, Lucia, about like that the being able to adapt the program to either do the outreach yourself or to have Machayla's team doing that outreach. I did want to mention to Jen, just to clarify, like I know you're like, okay, we need a clinical partner to make this happen, and that the AboutFresh Fresh Connect service is something that programs would contract and purchase that platform card service. So it's not a program in a box in the sense of like you need to have your own enrollment of your clients and a program system that you're running, and then you're partnering with AboutFresh for that platform and card use.
Yeah, because we applied to be HRSN providers, and so that's what, if we come through, that seems like right now I'm sitting on Canva making vouchers for the Fill Your Pantry to give to our clients and things like that. I'm like, oh, if I could not do this and there was just a card, that'd be great. So
Absolutely. And I did forget to mention that our platform has a retail report as well. So you can, if you have a program with us, you can run that report and actually see the dollars and the amount of transactions at all the retailers that your cardholders are using, which people find extremely interesting. So thank you.
Thanks so much, Machayla. And Machayla, if you don't mind popping your email in the chat for folks to connect with you after this call, that would be awesome. Thank you. Thanks for all the great questions too here today. We're gonna hop over to Gina from OHSU to talk about the Toward Healthy Lifestyles initiative, which is a partnership with the co-led and community-based organizations and some potential funding opportunities. So I'll let you take it away, Gina.
Yeah, good morning, everyone. It's good to see some familiar faces. So typically my co-partner within the OHSU IDS Health Equity team, Theo Latta, is here with you all. He's not in today, so you got me. I guess just to kind of back up a little bit, where I'm placed within OHSU is very specific. So there's the big OHSU organization, they have a health equity team. They also have a Medicaid health plan. I work within the Medicaid health plan of OHSU, and then more specifically on the health equity team within that health plan. And I share that just to kind of give some context for how the funding piece of this initiative kind of works, or what the goals need to be. So basically, Toward Healthy Lifestyles was developed as a way for the health plan, the IDS, to combat obesity, which is a huge goal. It's massive. And when that was started, initially it was Theo and Dr. Leah Warner. And then I was brought on not too long ago, earlier this year. And it was just an intimidating prospect. So we kind of were reaching out to different people within OHSU, sharing what we were trying to do, trying to brainstorm. And we found out that this other team within OHSU called Co-Led was really doing very similar work. It just happened that their specific target was diabetes. And there's such a huge intersection between those two things that we were like, why don't we work together, work smarter, not harder, and just build off of what each of us can bring to the table? What Co-Led has done historically and what they're doing now is bringing together different community-based organizations to brainstorm and really elevate the expertise that already exists within the community, instead of trying to reinvent the wheel or take a more paternalistic stance and direct to CBOs what needs to happen. Right now, with Co-Led's cohort of CBOs, there's Adelante, Feed the Mass, Growing Gardens, Miracles Club. I think that might be it. Anyone, if you know, please correct me. But CoLED is kind of in one part of this project, working directly with CBOs, gathering ideas, formulating how to move forward, doing small test runs of these different ideas that CBOs have, all with the end goal in mind being improved health. Over here, where Toward Healthy Lifestyles comes in, is kind of the funding piece, honestly. We have small awards, and for lack of a better word, small grants that we can offer anywhere from 5,000 to 20,000, depending on what the idea is. But they're awarded in, they can be individual to one CBO. It can be a partnership between CBOs, and that, the different amount will be reflective of that. But really, we just want to see ideas and support ideas that center healthy eating, social connection, and movement. So some type of exercise or physical activity. What am I missing? And as far as applying for these funds, there's not a formal application process, which is, it's nebulous. It's kind of weird. There's not like a form that we're giving to CBOs and saying, here, like, write 8 pages about why you want to do this thing. It's really just, if you're interested, it'll be a conversation that you have with me and with Theo and Dr. Werner, potentially somebody from CoLED. It could be Dr. Brian Park, Dr. Anthony Chang. But we're not trying to gatekeep the funds in any way. We really want to get these funds out there and get them supporting like really cool initiatives that folks have been thinking about for a while. I think that's about it. What can I clarify here? Because I know I just shared a whole lot.
Is there like a geographic scope?
Yes and no. Yes, in that because we're part of the HealthShare CCO, it'll probably, and OHSU is within like the Tri-County area for the most part. We do want to see these funds benefit OHSU IDS members in some way, not exclusively. It's not like we're going to tell somebody, oh, you don't have the right health plan, you're not eligible. That's not at all the hope or the goal. But yeah, I would say Tri-County areas is our focus for sure.
This is super exciting to hear about, Gina. I'm curious, you mentioned new initiatives. Is it specifically for new initiatives, or could it be for expanding initiatives? What does that look like?
I think right now I specified new just because that's where we're at with CoLED. That's where their brainstorming is at. But I don't think that it needs to exclusively be new. No, I think it's less about what it is and more about, does it meet the goals that we have in mind? Does it encourage social connection, healthy eating, some type of movement? Ideally, all 3 at once, or a combination of some of them. But yeah, I'll certainly, if we come to that in a conversation, I think it's worth talking about. I don't think we want to shoot down any idea that addresses these goals.
And who should folks reach out to if they want to have a conversation and have either a new or existing program they think that would help meet those goals?
Yeah, that would be me. I'll put my email in the chat. You can text me also if you want, or call. That's totally fine. But I'll put my number and my email in the chat. And I really do want to stress, like, we're not formal here. We really just want to talk to folks and see what's happening and what we can do to be helpful.
Other questions for Gina? Just a shout out too, if you are in the Portland metro area and you have not heard of CoLED, they're doing, besides this initiative, they're doing some really fantastic work. And so maybe great to connect with Gina, even if you're curious about other things that y'all are working on. And yeah, this collaborative of organizations and folks in the community. So
Is
yeah.
there by chance a website for any of this work? And or if not, could you spell CoLED in the chat, please?
Yes, we don't have any website for the initiative. CoLED might. I think that they do. I'll try to find it. And if I don't find it in time in the next 15 minutes, then I can send a link to somebody who can distribute it out.
Thank you.
Great. Well, we do have a little bit of time left. I know that we did have some new folks on the call today, and I just wanted to kind of open it up as an open platform. If you have questions that you came to this meeting with that you were like, I still like to ask that question, or announcements, celebrations, general statements, whatever you would like to put out there for the group, or maybe other folks that you're hoping to connect with that may not be on the call, but you're looking for who might be in your area. Feel free to unmute yourself or put anything in chat.
And Kaylee, I did pull together some resources just in response to some questions we received in the registration. Oh, I was going to say we can wait till the end if there are folks who have other things to say, but I can talk through these now. So first, I just wanted to share this webinar from Health Begins. They're an organization that works on upstream public health initiatives nationally. Really looking to improve social and economic conditions that make people sick in the first place. And I thought that this webinar would be potentially interesting for folks in this group. So they're going to highlight hospitals that are stepping into that gap and influencing food as medicine implementation in their communities. There's going to be 3 examples from throughout the country. Just talking about their food as medicine and Veggie Rx program design. So definitely from a hospital administrative perspective, but might be interesting and inspiring for folks. And then I also wanted to share just some funding opportunities. These were, there's a spreadsheet with a matrix that was shared in the last newsletter. And it's really focused on community health and Veggie Rx kind of program related funding opportunities. And then lastly, as someone already asked in this meeting, there were some questions about getting started on a Veggie Rx program. And I just wanted to remind folks that there are all of these resources on the Veggie Rx page on the OCFSN website, including just examples from program models in the state. There's some toolkits and manuals of how to get started, as well as more resources. So just a reminder that those are there, and I'll drop all those links in the chat right now.
You're the best, Claire. Thanks for sharing those.
But if there are other, wishes to connect, like Kaylee said, please feel free to continue that conversation.
I'll jump in and just say hi, everyone, and introduce myself. My name is Lauren Sawyer. I am a citizen of the Comanche Nation. I'm a public health nutritionist and registered dietitian, and I work at NARA Northwest, which is the Native American Rehabilitation Association here in Portland. We serve a primarily urban Native community, and we are an FQHC. Been at NARA for about just over a year now, and I work really closely with another dietitian, Janelle Bombera, who I was telling Shin this a little bit over email, but we just attended the Native Nutrition Conference in Minnesota, and it was really inspiring. And I think there's a lot of produce prescription stuff being done in Indian country, specifically on reservations. And it was really inspiring just to hear about all the work that they've been doing. And coming from the urban setting, I think Janelle and I were very like, how do we do this in Nara? Like, we have so much food insecurity that we see every day, really impacting our patients with diabetes and hypertension. And it really, I think, has become apparent to us that getting money in the hands of people, getting food in the hands of people is a really big deal. And in that kind of inspiration, coming back from conference, we started looking around online and learned about the Oregon Community Food Systems Network. So here we are. She couldn't make it to this meeting today, but I think in the future, we'd love to both join and connect with y'all in Portland and just kind of figure out, like, I think the biggest takeaway from the conference was really about how siloed our work can really be, and just that connecting with community, potentially getting away from some of the federal funding that we are so reliant on, that is constantly having our jobs be in this way of things. Especially as from a Native perspective, relying less on federal funding and government would be really awesome. So it's really nice just to hear that there's other funding opportunities out there, and there's other, ways to get involved with others in the community that are already doing this work or know a little bit more about the work than we do. So yeah, just I wanted to say hello and thank y'all for welcoming me. And it's been really inspiring just to hear about all the really cool work being done in Oregon and beyond. So thank you.
Thanks, Lauren. Thanks for introducing yourself. And I love when you go to conferences and you can bring that inspiration back and continue that learning and growing and expanding. Yeah. Oh, and Anna just put in another opportunity in the chat for a free virtual summit on food as medicine. Oh, it's tomorrow. Oh my goodness. Okay, clear your schedules and attend there. Just because it's nice to have like visuals for welcoming Lauren in this space. I don't know if anybody wants to wave their hand from the Portland metro area so that she knows, like, okay, who to connect to. Awesome. There's some friendly faces. Yeah, great.
And then another resource that we're planning on sharing is our biannual Veggie Rx program in Oregon census. So yeah, we'll be sharing that at the November convening. And I guess a quick question before everybody hops off, and feel free to come off mute or just drop it in the chat. At the convening, we will have 90 minutes set aside for this working group. What do y'all want to spend time on?
I'd love to just do some straight up networking, maybe some sort of facilitated, getting to know each other and programs a little bit better, so we can just have some time to talk about, possible areas of collaboration. I'd be very excited about that. And to Lauren's point, I think it is amazing to see, a lot of us are doing really similar work and we don't even know it. So maybe some way of sort of seeing, like, what are the similarities, what are the differences, and then, kind of looking for what are the gaps and opportunities in that maybe.
Thanks for sharing that, Sylvia. One of the ideas that someone floated a few conversations ago was wanting to have some space for more like operational problem solving for actual program operators through maybe a Claire, what was the phrase we used?
We're talking about it wasn't the challenge clinic. I don't recall what phrase we were using.
Kind of a challenge clinic of having someone bring a like actual real life happening operational challenge and having the group help work through it. Is that something that would be useful to anybody who happens to be on this call?
I hear the rule of thumb is like you count to 7 in your head, and then if no one says something, then you can break the silence. Um, these are great questions, though, and if you want to like mull around them too, and maybe actually perhaps have like being able to present a challenge that you're going through in your program is something that you would be interested in for the convening, let us know.
Yeah, or it could be on the flip side of this is a thing that I've realized makes running this program so a much later lift. And it's this really simple switch that we did. I don't know. That's also, I think it's also just a space for knowing that we're not doing this work alone and maybe picking up some tips and tricks. And also part of the art installation that I'm really excited for everybody to interact with is grief, because, you know, since last time we all gathered, a lot has happened. Gripes, because not all of the work is fun. And some of it's just a slog. And it's okay for us to recognize that and talk about it. And I feel like the more that we all talk about the challenges within our work, the more often we can collectively change some of those things, or at least just hold space. And then the glory is a little bit like there are still like big celebrations of what we've been able to accomplish together and the things that we are able to solve, even if sometimes it feels like, you know, just a little step forward. But I think the reminder for all of us is that this is generational work, and you know, we're just making it a little bit easier for the next folks that we're handing this off to.
I mean, I think I'd be interested to learn too, because we haven't really started one of these programs yet. We do it on a pretty small scale, but in Lane County, you know, one of our CCOs just pulled up stakes, and so much of this funding comes through Medicaid expansion and through the CCO's, you know, community benefit initiatives, all of those things. And so, yeah, without being too doomer, kind of talking about like how we can all get together and support each other, you know, build more collaborative programming, like find alternative funding resources, all of that stuff. Because I think the traditional funding model that I was expecting to be able to expand into is no longer there for us.
Yeah. Yeah, I feel like there are a lot of conversations about how do we braid funding together and how do we figure out how to collaborate together better. Well, thanks everyone for joining us today. New faces and ones who have been around for a while. Any final thoughts from anybody before we call it for the day?
I was going to call out that this is the last scheduled working group meeting for 2025. So make sure you're signed up for the Veggie Rx listserv. And I believe you can do that on the OCFSN Veggie Rx webpage if you are not already. And we will be announcing the 2026 working group meetings around December. So keep an eye out for that.
Thanks, y'all. Have a great rest of your day and week. And we'll
Take
see you
care.
hopefully in November.
Thank you.
Thank